New tonight, firefighters face serious health risks on the job that put their lives on the line. That includes exposure to toxins that can cause cancer. But much more is known about the dangers facing male firefighters than women in the service. Cronkite News reporter Jackie O'Neill tells us how some Arizona researchers are trying to fix that.
Researchers at the University of Arizona have launched a 3-year study to better understand the dangers women firefighters face. They're looking at stress levels, cancer risk, and reproductive health. The goal? To help protect those working to keep us safe.
Nicole Minnick found her calling as a firefighter almost 2 decades ago.
So when I moved out here, I did see an ad in the paper. It was right after 9/11. The Glendale was testing, and at that time, all the cities in the valley started testing at the same time. And so I just got involved, and really it was just my path.
7 years later, Minnick gave birth to her first child, a daughter named Kendall. But when she tried to seek guidance about the risk of firefighting and breastfeeding, she hit a roadblock.
I had gone back to work, and I was still nursing, and so I was pumping at work. And I think my second or third shift back to work, we had a fire. And, you know, my baby's 3 months old. And I was like, well, I probably shouldn't nurse her. How long do I need to pump and dump? And I called the fire department, and they had no idea.
What Minnick encountered is just one example of the unique health concerns that women in the fire service face. A new study at the University of Arizona will address some of those issues.
Women firefighters have a number of questions that they want research to answer. Some of their major concerns are around mental health, so stress, mental health, PTSD, also reproductive effects of firefighting, and then finally, cancer risk of firefighting.
Burgess and a team of researchers are recruiting 200 women from fire departments across the country to examine adverse health effects. It's research that is long overdue.
Man, even in our first studies, we had a lot of people that were asking questions about the health of women in the fire service. So women who were participants in our studies, who would say, do you know anything about, miscarriage or any of those types of things? And often the answer was, there's just not data out there.
After her experience years ago, Minnick joined a study about breastfeeding and firefighting. She isn't taking part in this latest research, but applauds any effort that helps keep her and her colleagues safe on the job.
When we get hired, we're young and we're invincible. And then you start to see the realities of the job pan out in tragic ways. And then, all of a sudden you're like, well, I don't really want that to happen to me. So when you see your brothers and sisters actually die from the cancers of this job, it becomes reality. So we're going in the right direction for sure now.
Firefighters take care of us, and so in the words of Dr. Burgess, it's our duty to work with the firefighters to answer the research questions so they can also take care of themselves. In the studio, Jackie O'Neill, Cronkite News.